how to release the pelvic floor in the case of endometriosis, pain with intercourse, or somebody who's experiencing constipation, bladder urgency, if you've got endometriosis, adenomyosis, pelvic pain in your pelvic floor, vagina, tailbone, etc. This could be a good exercise or technique to release the pelvic floor. So I'm using our pelvic floor wand today, and I also am using our water-based intimate gel. If you're using our wands, because they're silicone, you need to use a water-based gel, so it can't be oil-based or silicone-based. So a good quality water-based gel, some pillows or a wall to prop yourself up, and we are releasing mainly today through the deeper layer of the pelvic floor. So when you've got endo or some sort of pelvic pain, your pelvic floor often tightens in response to that pain. And then when you have intercourse or you have a speculum exam, you're using tampons, menstrual cups, etc. So things going into the pelvic floor, it can often be quite uncomfortable. But because the pelvic floor is so closely related to the bladder and the bowel as well, it can also give you bladder pain, bladder urgency, or can cause things like constipation or sharp shooting pain when you open your bowels, or rectal spasms. So when we're releasing the pelvic floor, we essentially want to go really slowly with everything and really be purposeful and use our breath. So we've got our pelvic floor wand, it's nice and lubricated. We are going through the entrance of muscles, so the entrance of the vagina, so we've parted the labia. The wand is going in with the neck facing down. So we're popping the wand nice and slowly into the entrance of the vagina, and if that's painful to start off with, you might go really slowly and really deliberately with each breath. So if this was the entrance of the vagina and you were having discomfort, I would go inhale, relax, exhale, just a little tighten of the entrance of the vagina, so squeeze pelvic floor a little bit, and then as you inhale, think about opening, blooming with a flower, so really thinking about opening the entrance of the vagina, and move the wand in a smidge more. Exhale and contract it just a little bit. Inhale, relax, breathe into your belly and your pelvic floor, open, move the wand. Contract, relax, move. Contract, relax, move, etc. until you're just shy of the neck or around that neck. So we want the pelvic floor wand to be a fair way into the entrance of the vagina. Probably don't need to go much further than the neck for most people. So we've popped the wand in, we've angled the neck down, we've got this then as our handle. So this is our driver, and whatever we do on the outside, so if I'm moving the wand to the left, it will essentially be the opposite inside. So you're moving it to the right. So it's like driving a tinny or a boat if you're from Australia. You're moving it kind of in the opposite direction. So when we move to the left, it's on the right. Now, if I'm not angled down enough, you'll just be floating around the vaginal canal. So we need the pelvic floor wand to be angled up towards your belly button and then to the side to get on that deeper layer of muscle, which is what we're trying to release. When we use pelvic floor wand, I essentially just encourage people to feel what, it's your body. Everyone's going to be slightly different. So you will know when you're on a tight and tender spot. For some people, that will be through here. For some people, it will be back here. It really just depends on the person. So we're going in, up, finding a tender spot, and then when you've found a tender spot, again, I'm using the wall, but you can just prop yourself up on pillows as well, whatever's most comfortable for reach without straining through your belly. We find a tender spot, we're going to take 5 deep breaths. So you're inhaling, feel the belly, feel the pelvic floor, exhale, let it all go. Inhale, expand, lengthen, open the pelvic floor, keep pressure through the wand, and then exhale, let the pelvic floor recoil, let go of all the air. The inhale is where the work happens. You're opening, you're expanding your belly, you're opening through your pelvic floor, pressure stays still with the wand, and then exhale, let it all go. Inhale, big exhale. One more inhale. Feel the belly, breathe into your pelvis, exhale. Then you might move spots. So you really just keep consistent pressure with the pelvic floor wand before we move on to the next spot. Find a new point of tenderness or discomfort, do the same thing. Now, if we're out to the side, out through here, we're getting towards a muscle called obturator internus, which connects directly or is more of a hip rotator than part of your pelvic floor. We can release this, and it's often quite tight in people, by doing movement with the hip. So if you're out towards the side, we can essentially then just bring the knee in, bring the knee out. Bring the knee in, bring the knee out. And if that's tender and sore with you and you're on the right spot, it'll essentially get a little bit more intense, a little bit less intense. And keep constant pressure with the pelvic floor wand on that area will help to just let that muscle go, move it more, make it more flexible, get more blood flow to the area, etc. So those are two of my favorite techniques that you can use. You can also use more of a sweeping technique where you're starting at one area and on your inhale, you're moving it to the next area. So more of like a massage technique. So we might do it like this. Inhale to prepare. Exhale, do nothing. And on your next inhale, move. So you're moving on the inhale, because the inhale is when we're thinking about expanding and opening through your pelvic floor. The exhale, you stay still, you let your pelvic floor recoil, you do nothing. Once you find a few tight and tender spots on one side, you can then move the wand over to the other side, which would just mean moving it on the outside to the opposite side, keeping that tension up towards your belly button, so still angling it up, making sure that we're still on the pelvic floor, and you can then repeat those 3 techniques on the other side. Now, when we're doing pelvic floor wand work or any sort of internal release, we don't want our pain levels to go above a 3 out of 10. So think kind of like a mild discomfort. It doesn't make you kind of wince in pain. It definitely doesn't make you, want to stop doing it because it's so uncomfortable. You are in control of the wand. So if it's too uncomfortable, just decrease the amount of pressure that you're using, or move away from that spot, do 1 or 2 centimeters on either side, and then move back to the spot that was quite intense with less pressure and see if you can release it through there. Now, all of our pelvic floor wand treatments or any sort of self-treatment that you're doing at home to treat pelvic floor symptoms is always best done under the guidance of a medical professional. So whether that's your pelvic floor physio or your gynecologist, you can find a clinician near you via the clinician locator on our website, and more free information and resources on our website as well. If you have any questions, then let me know below and I will do my best to help you. Hopefully this video has been helpful, and I will see you in the next one.